Hello everyone. Today, we're diving into the world of a medication called Jeuveau, known by its generic name, prabotulinumtoxinA-xvfs. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Jeuveau, or prabotulinumtoxinA-xvfs, is an injectable neuromodulator that belongs to a class of drugs known as botulinum toxin type A. It works by blocking nerve signals to muscles, thereby reducing muscle activity that causes wrinkles. Jeuveau was approved by the FDA in 2019 and is primarily used for cosmetic purposes, specifically to temporarily improve the appearance of moderate to severe frown lines between the eyebrows, glabella lines. Unlike other botulinum toxin products, Jeuveau is marketed solely for aesthetic purposes and not for therapeutic uses. Warnings: Jeuveau, like other botulinum toxin products, comes with important precautions. It should not be used in individuals with a known hypersensitivity to any botulinum toxin preparation or to any of the components of the formulation. It is also contraindicated in patients with an infection at the proposed injection sites. Additionally, the effects of Jeuveau can spread from the injection area to other parts of the body, causing serious and sometimes life-threatening side effects. These effects may include muscle weakness, difficulty swallowing, difficulty breathing, and vision problems. If any of these symptoms occur, immediate medical attention is necessary. Before taking this medicine. Before receiving Jeuveau, several factors need consideration. It is essential to inform your healthcare provider if you have any allergies, especially to botulinum toxin products. Those with a history of neuromuscular disorders, such as myasthenia gravis or Lambert-Eaton syndrome, should discuss potential risks and benefits with their doctor. If you are pregnant, planning a pregnancy, or breastfeeding, it is crucial to consult with your healthcare provider. The safety of Jeuveau in these conditions has not been established. Before starting the treatment, inform your doctor if you have ever had any side effects from botulinum toxin injections, if you have a history of breathing problems, swallowing problems, or bleeding issues, or if you have plans for upcoming surgery. It's also important to let your healthcare provider know if you have had facial surgery or plan to have facial surgery, as this could affect the outcome of the treatment. Side effects: all medications can have side effects, and Jeuveau is no exception. Common side effects include headache, eyelid drooping, upper respiratory tract infection, and increased white blood cell count. These effects are generally mild and temporary. However, Jeuveau can also cause more serious side effects. These include allergic reactions, which may present as itching, rash, redness, or swelling. More severe reactions could involve difficulty breathing or swallowing. Muscle weakness is another potential side effect, which can be particularly concerning if it affects areas away from the injection site. If you experience any unusual symptoms, it's essential to consult your doctor immediately. Additionally, there is a risk of botulinum toxin spreading to other areas of the body, leading to symptoms such as muscle weakness, double vision, blurred vision, drooping eyelids, hoarseness, loss of bladder control, and trouble breathing or swallowing. These symptoms can occur hours to weeks after the injection. Immediate medical attention is required if any of these symptoms develop. Interactions: Jeuveau might interact with other medications. It is crucial to inform your doctor about all medications, supplements, and herbal products you are currently taking to avoid any adverse interactions. Medications that can affect or be affected by botulinum toxin include muscle relaxants, allergy or cold medications, sleep medications, and certain antibiotics. Dosage: the correct dosage and administration of Jeuveau are vital for its effectiveness and safety. Jeuveau is administered as an injection into the muscles, typically given by a healthcare professional experienced with botulinum toxin injections. The dosage is individualized based on the patient's needs and the professional judgment of the healthcare provider. For the treatment of glabella lines, the recommended dose is 20 units per treatment session, divided into 5 injections. Each injection is given in a specific area of the muscles responsible for the frown lines. Avoid: while receiving Jeuveau, certain activities and substances should be avoided to minimize the risk of side effects and ensure the best results. It's advisable to avoid alcohol for at least 24 hours before and after the injection to reduce the risk of bruising. Additionally, strenuous exercise should be avoided for a day or two following the treatment. It's also wise to avoid rubbing or massaging the treated areas for several hours post-injection to prevent the toxin from spreading to unintended areas. FAQ: Many wonder about the age restrictions for Jeuveau. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Jeuveau. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.